You have hypothyroidism. You might even have Hashimoto's, and you're taking your thyroid medication as you've been told to every single day, but you still feel terrible. You're beyond exhausted. You can't lose weight for the life of you. You're losing hair in clumps, and you're so bloated and backed up that by the end of the day, you look 6 months pregnant. But again, you're taking thyroid medication. So why do you still feel this way? If this is you, first of all, you are not alone. And second, this video is going to give you all the answers that you've been looking for. Hey everyone, I'm Dr. Rochelle Vong, a naturopathic doctor in Toronto, and I've spent over a decade helping women with hypothyroidism and Hashimoto's get back their energy, lose weight, and finally feel like themselves again by getting to the root cause of their thyroid issues. So here's what's really messed up about this situation. So many of my patients have spent years upon years struggling with their symptoms on their own with absolutely no help, no support, and no answers from their conventional practitioners. And then finally, sometime down the road, they get a diagnosis of hypothyroidism or Hashimoto's. And initially, it can feel quite relieving to know that there is a reason for why you feel this way, that, it's not in your head and you're not crazy for making these things up. And then there's this promise of a solution, thyroid medication. And so often I hear from my patients that their doctors literally say that this one pill is all they need. They just need to take this one medication every day and it will get rid of all their symptoms. They're going to go back to normal and everything is going to be okay. And that's a huge promise to make. And I know it's with good intention because this is all that conventional practitioners have in their toolbox to treat hypothyroidism. So I get it. But the reality is that so many people still feel terrible even when they take their thyroid medication every single day. And this is where I think the biggest gap lies in the approach and conventional treatment of hypothyroidism. Because what happens to that woman who now takes her thyroid medication every day and still suffers? She goes back to her doctor hoping for another solution, only to be handed the answer of, there's nothing else to be done. So the only solution for her at this point is to just accept that this is what the rest of her life is going to look like. And personally, I think that's terrible. And I refuse to accept that that's going to be the final answer for anyone. So I wanted to break this down. I want to give you the answers that nobody is giving you. I'm going to tell you exactly why you still feel terrible despite taking your thyroid medication every single day. And then you can take this information and move forward in your thyroid healing journey because this is not the end of the road for you. There is so much, trust me on this, so much that you can do to start feeling better right now. So before I get into it, I just want to preface this all by saying that I am not against thyroid medication. I might be a naturopathic doctor, but that in no way means that I'm anti-medication. In fact, I actually think that thyroid medication is absolutely necessary in most cases and can be life-changing. But do I think that we should solely rely on thyroid medication and expect it to fix every single symptom that we have? No, I don't. And that's what I have an issue with. The narrative that this is the only solution to your thyroid problems, because obviously it's not. So there are three main reasons why you still feel terrible despite taking your thyroid medication every day. And if you identify with any one of these things, then at least you'll know exactly what to start looking into and what to investigate. So let's get into it. The first reason why you still feel terrible despite taking your thyroid meds every day is that the majority of you have Hashimoto's thyroiditis. Statistically, 90% of people with hypothyroidism have Hashimoto's. And this is an autoimmune disease that slowly attacks your thyroid, which then causes hypothyroidism over time. Hashimoto's is an immune system problem, not a direct thyroid issue. So thyroid medication, which only replaces thyroid hormones that are lost, does absolutely nothing to actually address and resolve the autoimmune problem that's happening in the background. In other words, it doesn't fix the root cause of your problem. So you could be taking thyroid medication every day and have this autoimmune process still going on. It's like replacing water in a bucket that someone is constantly still poking holes in. It's ineffective. And this is often why I see so many people having to increase their dose over time because you're not actually addressing the driving force of your hypothyroidism in the first place. Now, the second reason why you still feel terrible despite taking your thyroid medication every day is that you could be a poor converter. What that means is that your body is not converting or utilizing your thyroid medication effectively. Now, this only mainly applies to T4 only medication like Synthroid or levothyroxine because these meds are synthetic forms of T4, which is our inactive thyroid hormone. It's inactive because on its own, it doesn't really do very much. So the tissues of your body, mainly the liver and the gut, need to convert that T4 into its active form T3 in order for it to actually bind your cells and do all the wonderful things that your thyroid hormones do, like optimize your metabolism, your energy, your mental clarity, etc. So if you're a poor converter, your tissues lack the ability to do this conversion effectively, and you'll be left with suboptimal levels of T3, which will then cause the symptoms of hypothyroidism that you're currently experiencing. And the crazy thing is that on blood work, on paper, your TSH, which is your thyroid stimulating hormone, the one test that all doctors love to do to measure thyroid function, can look completely normal. So without doing a full thyroid panel, you might actually never know that you're a poor converter. More on this in a future YouTube video. Now, the last reason you still feel terrible despite taking your thyroid medication every day is that it might not actually be your thyroid. Having hypothyroidism can cause changes in literally every system, every part of your body. So while your thyroid hormones might look balanced because of your medication, there are still a lot of other imbalances that could be happening in your body. For example, a really common issue that I see in my patients with hypothyroidism is blood sugar dysregulation, specifically insulin resistance. And this can be a long-standing consequence of an underactive thyroid, but can also make symptoms of hypothyroidism worse. It is often one of the biggest culprits for stubborn weight loss in women, as well as fatigue, brain fog, and anxiety. Another issue that I see a lot is fatty liver. So many of my patients with hypothyroidism have fatty liver, which can then compromise your body's ability to properly detox, metabolize hormones, cholesterol, and convert your thyroid hormones, since 60% of your thyroid hormone conversion actually happens in the liver. And this is where so many women get stuck because once we blame everything on the thyroid, oh, it must be the thyroid that's doing this. Oh, it's the thyroid problem. We stop looking for answers. We stop asking better questions. Because what if your fatigue isn't just your thyroid? What if your weight gain isn't because of your thyroid? What if your anxiety isn't because of your thyroid? So while it's easy to place the blame on your thyroid since you have a thyroid issue, and then think that it's all going to be solved with thyroid medication, we are completely missing huge pieces of the puzzle. And this is why doing a proper deep dive and investigation into all the possible root causes of your symptoms is so crucial and something that I think is entirely missing in the conventional approach and investigation of thyroid disease. So my hope is that by now you understand that taking thyroid medication, as hugely important as it is not the only solution to your debilitating symptoms. Hypothyroidism and Hashimoto's are complex disease processes which require a comprehensive investigation and approach to treatment. If you are a poor converter, you got to figure out why you're a poor converter. There are so many reasons, so many factors that can cause poor conversion. Things like stress, things like toxins, poor gut health, and the list goes on. So when you do a proper investigation, you can actually determine what the underlying root cause of your issues are. And once you address that and resolve that, everything will improve. Unfortunately, we have been conditioned to have such a very narrow tunnel vision when it comes to addressing our health. But now more than ever, and I think more people are thankfully waking up to this idea, we need to widen our lens. We need to widen our perspective of our health and realize and understand that every system of the body is connected. And so treating a thyroid issue no longer is just treating the thyroid. It's looking at all the systems that are connected to that thyroid. This is the only way that you're going to start seeing long-lasting improvements to your health. If this video gave you some relief, knowing that you're not crazy and knowing that there is so much left for you to do, then please like this video and stick around. I'll be posting new videos hopefully every week breaking down thyroid health in a way that makes sense. So make sure you subscribe to this channel, and I'll see you in the next video.